And welcome. Great to have you today. My name is Gina Constantakopoulos, and I'm with Matter. Today we're doing connecting chronic care with oral health. Matter is a healthcare technology incubator and innovation hub with a mission to accelerate the pace of change of healthcare. Now, since we've launched in 2015, we've supported more than 1,000 startups from all over the world, and we have a suite of services to help them at every stage of development. We run between 6 and 8 startups accelerators every year in partnerships with large health systems, life sciences companies, payers, associations, foundations, each one focused on 5 to 10 companies innovating in a particular area of healthcare. We work with dozens of health systems, payers, and life sciences companies, helping them collaborate with the right entrepreneurs and innovate more efficiently. We're also the digital health hub of BARDA's Accelerator Network. BARDA is an arm of the Federal Department of Health and Human Services, responsible for innovations to improve the country's resilience in the event of public health threats. And we host events focused on healthcare innovation, bringing people together to be inspired, learn, and connect with each other. So this is our 4th year of working with CareQuest Innovation Partners on Smile Health, an accelerator program where transformation solutions to improve oral health care take center stage. We are quite literally empowering innovation that helps the world smile through propelling the integration between oral health and overall health. So for the past 3 years of the program, we sent out an open call to entrepreneurs around the world with solutions to make oral health care more accessible, equitable, and integrated into overall health. We received close to 300 submissions from around the globe and have 16 alumni companies of the Smile Health program. These companies receive mentorship, curriculum, and most importantly, validation studies with industry leaders and investors such as Cigna, DentaQuest, and Seven Wire Ventures, some of whom are here with us today, and additional companies. We launched the 2025 Smile Health Program in March with 3 main focus areas: advancing accessible, equitable, and integrated health, engaging people in their oral health, and connecting chronic care with oral health. Today, we're joined by leading industry experts who will discuss the most important connection between chronic care and oral health. We're joined by Dr. Carrie Sun, Chief Dental Officer, Cigna Dental, Dr. Ryan Huntgate, Chief Clinical and Strategy Officer for Schein One, and Lee Shapiro, partner of Seven Wire Ventures. We're also joined by our moderator, Katie D'Amico, the Vice President of Growth and Innovation at CareQuest Innovation Partners. After we hear comments from today's panelists, we'll share more details about the Smile Health 2025 program, including how you can apply and get involved. So now I'd like to introduce our moderator for the day, Katie D'Amico. Katie is the VP of Growth and Innovation at CareQuest Innovation Partners, the for-profit subsidiary of the world's largest oral health nonprofit, CareQuest Institute for Oral Health. Katie advances the mission of improving oral health for all by identifying, validating, and scaling innovations through impact investing, advisory roles, and CareQuest's Smile Health Accelerator. With over a decade of experience in healthcare innovation, including her time at Deloitte Consulting's healthcare practice, Katie has worked across health plans, health systems, and emerging health players to design, pilot, and scale transformative solutions. We're thrilled to have her guide us today and in the conversation. So take it away, Katie.
Thank you, Gina, and for being wonderful partners with us and the Matter team on the Smile Health Accelerator. Very excited to be here today and facilitate this discussion, talking about the importance of the intersection between oral health and chronic conditions. Gina did a great job overviewing CareQuest and CareQuest Innovation Partners, very much focused on improving the oral health for all, with a commitment to underserved and underrepresented populations. We do this through our Smile Health Accelerator. You'll hear a bit more about that today. We also do impact investing and various innovation services, partnering with other companies to pilot and scale innovative solutions. As Gina mentioned, we are in our 4th year of our Smile Accelerator and have already seen some amazing, impactful solutions that are changing how we look at oral and integrated integrated health. Companies like Grin, a platform that uses AI for preventative mouth scans, to companies like Lura, a non-invasive wearable that it can be implanted into the mouth and uses saliva to continuously monitor health. These companies have demonstrated opportunities not only to address unmet needs, but also grow strong businesses. And a truly unique component of our Smile Health Accelerator is that it's brought together over 20 different industry leading companies and investors to collaborate alongside with our startups to help validate key areas of their solutions. We're now, over the 3 years, have worked with numerous startups, over 20 different validation studies, and we can truly say Smile Health is advancing solutions to make an impact. I want to thank all of our industry and investor partners for their ongoing support and collaboration of this program, especially Cigna, Henry Schein, and Henry Schein One, and Seven Wire Ventures, who are here with us today. So before we dive into the panel, I did want to spend a few minutes and set the stage for this discussion. And as many of you know on this call today, oral health is often seen as separate from overall health, though we're working to change that. And as you'll hear here today, it plays a critical role in preventing and managing chronic diseases. We know that oral health is deeply connected to conditions like diabetes, cardiovascular disease, and even mental health. Yet historically, it still is not integrated into chronic care management. Let's take one disease, periodontal or gum disease. Individuals with gum disease have 2 to 3 times more risk of having a heart attack, stroke, or another serious cardiovascular event. And the linkages work both ways. Diabetes also raises the risk of developing gum disease by nearly 90%. And so, of course, these are a few data points you're going to hear about more today. And the impact on individual lives cannot be understated, nor can the financial impact of these untreated oral diseases. Medicare alone spends $520 million annually on dental emergency department visits, many of which are preventable. So today thank you so much to our panelists who are here today that are really going to unpack this more, highlight the importance of bridging this gap, and then also sharing some actionable tactical insights that we can collectively work on to continue to enhance both oral and overall health. So today we have, again, I know some people are trickling in late. We have Dr. Carrie Sun, Chief Dental Officer of Cigna Dental. We have Dr. Ryan Hungate, Chief Clinical and Strategy Officer of Henry Schein One. And last but certainly not least, we have Lee Shapiro, who is a partner at Seven Wire Ventures. Thank you all again for being here today. And so I'll start it off with a low-hanging fruit question to you, Carrie. Would love to hear your perspective on, where you see the greatest connections between oral health and chronic diseases.
No, thank you, Katie. And it's interesting that, we're talking about the connections between oral health and overall health because, this started probably in year 2000 when we got the Surgeon General's report on oral health in America. And that's when it really started opening up this whole idea of those connections between our mouth and the rest of our bodies. And in particular, as you mentioned, gum disease seems to be the main connector to a host of chronic conditions, and you listed a couple of them. But one of the things that we've seen since that time is the development of other connections, chronic kidney disease. We've seen some of the autoimmune conditions like lupus, rheumatoid arthritis, Sjogren's syndrome, etc. And the list kind of keeps going on. So I think one of the challenges that we've faced is that we still, while those connections are there, we still haven't found the causality, in part because a lot of the chronic conditions and gum disease have similar risk factors. So hard to really nail down what is that direct connection. But certainly something that is critical for us to kind of see the value of, when we treat oral health, how does that impact and help those in terms of their chronic conditions as well.
Great. Thank you for that. And building on that question, Ryan, I know you're sitting on quite a bit of data there at Henry Schein and Henry Schein One. Would love you to build on that and, maybe where you're seeing some of those linkages and where the data really supports it as well.
Yeah, we're seeing a bunch. First, thanks for having me on here. This is fantastic, and it's really exciting that this is coming to the forefront of everybody's mind. Data is the key here. I think a lot of us had hints at this, and they were able to do, studies of 50 people at a time, or 75 people at a time, or some crazy like 100. We've got hundreds of millions of patient life records, right? And the correlation is just very apparent on this stuff. We're right now running some studies with different groups on the relation of A1C and prevalence of type 2 diabetes or pre-diabetic, right? We kind of know it exists today, and we've seen the good studies out there that exist, but now we're able to do it in mass and quickly with adding things like artificial intelligence have been able to help this, where I used to have to search notes, and when you say, oh yeah, it's really easy, just read 52 million right, patient notes. That's not a thing, but the AI can do that in 10 minutes. So it's just amazing data coming forward. The trick to all this is not just proving out that these exist. I think that we have that, right? Or I think everybody kind of knows that. We're taught that in dental school. But it's more so, what do we do with it now? So what are the next steps? How do we, if you tell a doctor, they also have to learn something brand new and then do something brand new on top of all of this. It's not as easy to apply. So I care a lot more about how are we going to really apply this in the world, right? How are insurance companies going to deal with these findings? Because I think that it's not just about the doctor finding this and giving the patient's lives better. Insurance companies are going to save some money too, right? Which is great. And I think the more we can help doctors synergize with the payers, thumbs up, right? We want to improve those relationships. So a lot of really cool stuff coming, and a lot of great health coming for our patients.
Great. Could not agree more. This transitions nicely to the next question, and I'm so glad we have Lee here as well, who really brings the broader healthcare perspective in addition to our panelists. And Lee, question for you, and I think it's a question many of us have and are working to combat. You've worked now in the consumer and chronic disease space for many years. Why do you think oral health delivery remains siloed despite what we're hearing and what we're seeing in the data of that connection to overall health?
Well, Katie, thank you for inviting me. It's a pleasure to be here with Carrie and Ryan. We have a specialization, you could even call hyper specialization problem in healthcare. For all of us who experience healthcare, we know how fragmented care delivery can be. And I read a study, it goes back a few years, but at the time it was done, 70% of all medical schools offered less than 5 hours of training in oral health. So physicians who are trained to take care of individuals, their primary care, they're the vanguard. They're supposed to be out in front and helping to understand and assess the clinical needs of their patients. They get less than 5 hours of training on oral health. So they're not thinking about things like oral cancers. They're not looking for signs of diabetes. They'll rely on their blood tests, and they're not partnering with their colleagues who are practicing oral health in a separate setting. Reimbursement codes are different. There is a separate set of codes that reimburse for dental services and medical services. There's limited crossover, in preparation for this session today. There's like a code to do a dental review ahead of a certain type of surgery or ahead of a radiological procedure. But, finding a code that would even reimburse a provider for taking on a screening, an oral health screening to better understand whether or not someone has health needs, doesn't exist to my knowledge. I'm not a doctor. I just play one on TV, but that's, but that's at least what I was able to find. So I think that oral health delivery is siloed in some sense, almost deliberately, as one of the many areas of specialization in healthcare. I think that also points to areas where we might be able to think about potential solutions longer term, but that's why I think we have some of those challenges that exist today.
Completely agree. And
Mhm.
Carrie, would love your perspective on the topic of incentives and being you are a payer. How do you see opportunity to better align incentives that, payers and providers, who are a key piece of this puzzle, to at least
Mhm.
value medical dental integration?
Yes, that's a great question. One of the things that because we have both medical, dental, and other lines of business, one of the things that we've been able to see is that in our populations that have both dental and medical, and when we have individuals with some of these at-risk conditions getting treated for oral health, we start seeing medical costs go down for that group. So we see the definite need to help encourage the dental work to be done. And so one of our programs is really trying to incent, meaning I would say we're trying to help an individual patient that has one of these chronic conditions, and if they have gum disease, how do we maybe increase their benefit to help them take that step to get it done instead of foregoing that treatment? And from that, one of the things that helps our providers is that help on the financial end tends to help cause the patient to accept treatment plans from our providers. And so one of the things that we tried to do is really work with the patient to enhance or change their benefits when they have these conditions, and how do we promote that with our provider network so that they will take advantage of that, help the patient, and then help, you know, overall, we're going to get a better result in the end.
Definitely. No,
Yeah.
that's great, and applaud you and the Cigna team for starting to take that leap and drive the momentum in the industry to be looking at more of these integrated types of
Mhm.
plans that really put the patient and the member at the center.
Yes.
Ryan, I'm sure you're itching to bring a perspective on the role that EHRs, EDRs, interoperability will play here. That's something that we haven't touched on yet.
Yeah, absolutely. Like I was saying before, I think we all understand that it makes a difference. The
Mhm.
way we look at dentistry is we're the tip of the spear. Yeah, I have a lot of MD friends that are like, "Who the hell was your marketing person?" Right? Because like we somehow convinced people to come see us twice a year. And I almost want to go back to that marketing person and be like, "Why didn't you say three times?"
Yeah.
Right? Because people see us twice a year. And you talk to the same person, you go, when was the last time you saw your MD for your general, physical? Unless they're over, let's call it 50 or 60, most of them answer like, I don't know, right? I don't know when it was, six,
Right.
7 years ago when my mom told me to, right? Like that's probably what the answer is. And then after that, there's like that span of like from like 20 to like 40 where you just disregard your health. And I think that what we need to do is we need to acknowledge that we're the tip of the spear. We do see patients more often, but we need to also make it easy for our providers to administer things that help the medical dental integration. So let's take, for example, there's some really cool people out there with some large groups and small groups that are doing blood tests. Right now, it's one thing to say, okay, take a blood test, take a reading of that blood test, and then it integrates into the PMS platform. That's one thing that we're doing at Henry Schein One, that we can make it very easy to integrate that data. But that's not where it needs to end, because really it's the so what that we need to figure out. Like, how do I get that over to Dr. Carey, right? For him to eventually look at one day and understand that, hey, if I can find diabetes 1 year earlier for that patient, I'm probably going to save that patient in that lifespan, and probably Cigna maybe 100 grand. So then what happens is when you have somebody that's got medical and dental insurance, they look at that and go, okay, I should maybe reimburse for that tiny blood test that probably only costs $7 or $25.
Mhm.
I know I can charge the patient right? Obviously, and they're saying I want a better health, and I think that we're also in a generation now that I have an Aura ring on my finger telling me how I slept last night and what my resting heart rate is while I'm doing this presentation. But at the same time, like, so I think people are really excited about their health and love to see the analytics about their health. But it's another thing that when my Aura ring tells me, oh, hey, you had a stressful day yesterday, take it easy today, eat better, and go to sleep an hour early tonight. Those are actionable things I can do. So I think we need to take this data and not just be able to pass it from a dentist to a medical doctor. That's a big thing. We have to be able to make that easy. So it's about getting getting that data in a readable format. And we recently just did this with the FDI internationally. We came up with a set of 12 different readings that we can pass universally between the FDI or a dentist and a medical doctor that we all kind of agree on. That was a big first step. Now it's the getting it passed and getting it interpreted. So again, I'm not going to outside of dental school where we were all really probably the smartest we ever were. Now after that, what happens is we got really good clinically, but I bet if we all took our part two boards again, it'd probably be a bit of a struggle. So we need to really make all of those dentists as smart as they were at that moment and kind of make them more medical physicians. That's where AI comes in. That's where what we can do is we can look at this data that we have and give them the so what. Hey, what are the next steps? Well, because they have high blood pressure, plus these couple readings on the blood test that you just administered, you need to write this referral, this referral, this referral, and I wrote it for you. And if you read it and agree with it, just click the send button and it goes over to their MD. That's the level that we need to get participation from all of our doctors. And then what happens is we get our payer friends going, hell yeah, this makes a big difference. Let's apply this universally. And that's when you start getting larger DSOs involved and kind of that trickle down that occurs from when the DSOs adopt something. Then eventually the SMB, smaller practices are like, okay, this makes sense because everybody's getting reimbursed. So we really need to I know those are a lot of steps that I just hit, but we're there. The technology is there. So everything I just said, I didn't talk about a flying car. It's there. We just need to actually get it done.
Yep. Good steps. I think that tee up the opportunity in this space right now. And I know we have a lot of startups on the call, some of our past Smile alumni, others that are applying to the Smile Accelerator this year. And I'm sure would love to hear your perspective on, what types of innovations or partnerships or funding you see critical to advancing more of an integrated health model. And so I know we've talked a little bit about AI, but maybe getting a little more tactical on, other types of solutions or innovations that are very top of mind, as you see is really going back again to the focus of this discussion too, is connecting oral health more to chronic conditions. Where are you looking? Where are you most interested?
Well, Carrie touched on this before, and I think we're trying to move the mindset away from siloed health to whole health, and it started by a better integration of physical health and mental health, and you've seen movements towards parity in reimbursement around mental health services that exist. Um, there are a number of I'll call them entities that have risk for the health of the population that they serve. So whether it's a health plan that has risk, and the health plan might offer some dental services, typically it's offered, by, let's say, an employer as an add-on as a service. But yet, if you think about a self-insured employer, and Cigna has many self-insured employers as part of their national account group, they're taking on that full cost of exposure for their team members. They have a set amount that the population takes on as an out-of-pocket copay and deductible. And then the rest of those costs are the ones that have to be funded by the individual. And so, in this model, we're, I think, partnering with self-insured employers because they're funding those costs. They're writing the checks to their third-party benefit administrator like Cigna, who's funding those services. And they would probably be the first place to have a strong interest in this. Medicaid populations, we've kind of chatted about this, Katie, in prior conversations at CareQuest. There are coverage is provided for individuals in Medicaid programs in many states that also cover dental services. I think that's also an important place to look at underserved populations. And and for innovators to be thinking about ways in which you can leverage the type of funding that might be provided through Medicaid or through self-insured employers that would be an integrated model for medical and dental care. Um, those are some of the areas of opportunities that I think of. Maybe, one other thing that I would mention, because we're talking here about the U.S. marketplace, many of the entrepreneurs and early stage companies that are on the call, some actually started in other jurisdictions, other countries, and are working with Matter. In those countries, you'll find that the fragmentation, the balkanization of healthcare that exists isn't the same as we have in the US. And you might find some very willing partners with
Yep.
government healthcare services to be able to provide that integrated approach towards oral and dental care. So think globally as well, and you might see more opportunities in that aperture.
Great perspectives. Thank you, Lee. Ryan or Carrie, anything that you'd like to add?
Yeah, actually, one thing I'll add is exactly what Lee just said. A great example of that is Estonia. You know, a lot of people aren't, thinking Estonia when their first go-to market strategy. But at the same time, I gotta go rock the economic situation of Estonia. But at the same time, you're 100% right, Lee. This is what happened. They actually took those pieces that we recommended in the FDI, they mandated it, right? The government mandated it, said, hey, they were able to write a policy, get quick agreement on it, mandate it down. Obviously, a much smaller number of doctors, but now they're showing this beautiful handoff of information between dentists and medical doctors. And it's working, and they're watching healthcare improve, right? I think we've seen kind of that decline in the health of America versus not the developing world, but maybe other more evolved economies out there. And I don't think that our complexities help that, right? I think that it's changing now because of the microeconomic and macroeconomic things that are happening, right? It's because it's not just the doctor and the practice feeling the heat on the rising cost of employment. It's also, well, look, Dr. Carey feels that over at Cigna too. Everybody's feeling the exact same. So everybody's looking at what AI can do to make things better. We're looking to make these interactions happen. Like we recently just deployed some eligibility technology so you can just retrieve it immediately within your health record. You don't have to go outside of the PMS to do this. You don't have to wait on hold to do that. That doesn't just help the practice. That helps Dr. Sun with his call times over at the eligibility center, right? So this is a big deal where it's kind of like uh, I help you, you help me world. And I think that you're going to get a lot of movement within the US on this soon. But you're absolutely right, Lee, that there's a lot of opportunity in a more simplistic healthcare system internationally in a lot of different places, especially with nationalized healthcare.
I didn't realize this was going to be a panel on Estonia.
Yeah,
But there
you
was
didn't?
but
Yeah.
there was a study, from 2021 that I located because I remembered, something about this, and it was listing, 17 countries that have better healthcare than the US. And, it starts with the 17th and comes down. Number 11 was Estonia. And like the average out-of-pocket spending per capita in 2021, so this is now kind of middle of pandemic, was $679. And, comparatively speaking in the US, it's, multiples of that, and yet their healthcare is better than the healthcare in the US. They have universal coverage. That's a very
Yep.
different approach, but they also have coverage with regard to oral health. So, in case anybody on the call today is thinking about a place to move, Estonia, could be on your list. And just in case you're curious, the number one country that was listed, I think I'll have to come back to you on that because it only gave me kind of down to number 6. So I'll have to refresh my screen, and I'll come back with number
All
1.
right.
Awesome. Carrie, anything you'd like to add?
Yeah, certainly really agree with what Ryan and Lee are saying. And I think one of the great things about Smile Health is, really trying to pull and encourage innovators to kind of help in this space because realistically, the tools that we have, especially as we think about clinicians. So And it comes from both the dentists, dental specialists, as well as on the medical side. We all need to have the right tools because we're so focused on our own areas of practice. We already are dealing with restorations, periodontal disease, all that, and let alone trying to see that on a broader scale for that patient in terms of their overall health. Similar on the medical side, they're focused highly on those chronic diseases, and they may get that little window of understanding how it ties into oral health, but us as clinicians really need those tools. So whether it's an electronic health record that gives us more information or things that help um, broaden our focus and helping us to feel more comfortable, because I would say a lot of dentists are a little bit uncomfortable kind of pushing themselves into regularly referring patients to physicians. We always refer to the root canal specialist, the oral surgeon, but how often are we really going to that step of, hey, I'm really seeing your blood pressure or an A1C that I've taken that suggests, hey, you really need to see your physician. So I think whatever we can do to expand that and help clinicians feel more comfortable going beyond just their area of focus, that's going to be critical. So I really applaud this program that is trying to look for that innovation.
Great perspective. And, a theme across what I heard from all of you was, well, the solution may be hyper technical or complex. What it's solving for should actually be relatively, if not entirely, straightforward and simple. And, I think that's a great insight for startups to keep in mind, really know the solution or the need that they're solving for and who it's solving for as well. Because whether it's on the dental or medical side, there are differences in terms of, needs as well too.
Katie, just one quick thing to add, and Carrie's comment spurred an idea at my end, which is, like we're talking about what we believe the medical profession, the medical infrastructure should be focusing on dental care. There are opportunities on the dental side to be thinking about medical care. So you talked about blood pressure. Ryan notes people are coming in twice a year. You're there, you're sitting, you might be, in the chair waiting for someone to come in. Someone could easily take your blood pressure, while you're relaxed in the dental chair. Are there simple blood tests that could be done in the dental office that can help inform preventative care? Because it's an opportunity to interact with a medical professional that would allow for more intervention. Matter has run some programs that have been focused on delivery of care in unique situations and circumstances. For example, helping with blood pressure management at barbershops, as a place that people are going to, and is that a place to educate people on hypertension?
Right.
There's no reason why we couldn't be doing the same thing in
Brilliant.
dental office, and that will help build more linkages between organizations that are all focused on making sure that that individual leads the healthiest life possible.
Could not agree with that more. And some of the pilots and work that we're looking to advance with our partners. And, the data shows it too. There's hundreds of millions of Americans who see a dentist, but do not see a PCP. So that is a critical point, right, where they could be steered into the medical system, or at minimum have some of their preventative screenings taken during a dental visit. So super exciting. Lee, a question for you too. You bring a great perspective also to this panel as a investor. And so we do have, again, many startups as part of this discussion today. How should startups think about either starting in the oral health vertical or entering from the medical market? Would love any insights that you could share there. Again, more from a investor perspective.
So when I think about investments, I think of it less as which vertical, and in fact, and continuing to promote that separation, and really much more about what's the outcome, what's the result that you're going to achieve. So at the end of the day, what matters is delivering better health outcomes at a better cost. That's what, if you start thinking about even the elements that we look for in the companies that we back, because of our focus on the consumer side of healthcare, we want to see a great consumer experience. because that's what keeps people coming back and engaging with an offering and
Mhm.
learning from it. It's improving their health. They want to stay engaged. It has to have measurable outcomes that demonstrate that by utilizing this solution, you're improving health. And lastly, you have to be able to do that in a way that delivers a return on investment who's ever at risk for the cost of care. So my view is, if you go to a health plan, if you go to a self-insured employer, if you go to an at-risk medical group, and you're able to demonstrate that your offering, if you're focused in the oral health market, is able to demonstrate strong outcomes at a price point that's, once you factor in your cost, you can show that by avoiding some of these downstream health problems, we're capturing it early, we're doing this oral health work, and we're able to save you money,
Mhm.
you'll win. And it doesn't necessarily matter whether you say, well, we're going to start in the dentist's office or we're going to start in the doctor's office. What we're going to do is we're going to start with a focus on the member, on the consumer, and how is it that we can help improve their health in a way that delivers these great results. And so I think that's where keep your eye on the prize and how do you improve health for that individual who's going to benefit from your offering.
Great advice. Ryan or Carrie, anything you'd
And
like to
add Austria, just to finish off the comment from before.
Yeah.
Number one, Austria. They have good food there too. So, there's a double benefit. Sorry, I cut you off
There you
talking.
go. Little
Mhm.
little Edelweiss goes a long way. Um, so I think that I always say first, the way you enter any of these verticals is probably with a prayer. But at the same time, after you get that done, there's so much opportunity. There really is, right? When you go here, it is not neat. I look at the dysfunction as opportunity. Um, the one thing I would recommend to every single one of them, because I recently had a software startup called Simplify, and the way we looked at all of these problems to be solved is change is the devil for any practice. Okay. You got to remember that dentists aren't struggling. They're doing great right now. Even during like the 2008 financial crisis, I think dentistry grew 3%. COVID, not so much, right? But at the
Mhm.
same time, it bounced back from that. We'll see what happens with the economic turmoil that's happening right
Mhm.
now. I'm not sure how good it'll do there. But at the same time, there is opportunity, but change is the devil. And what I mean by that is that if you've already got a couple of BMWs in a vacation home, really you've got more to lose by changing. So what you have to do is if your product works without them doing anything, you have a chance. But if you're like, hey, doc, I want you to change this, that, and the other, and you have to do these extra things, and then you'll become this much more efficient. You're not going to sell anybody on efficiency. You're just not, right? But what you might sell somebody on is making them more revenue, right? That's one of them. Improving patient outcomes, therefore you make more revenue, or making it so I can take my operational efficiency to a completely other level, aka artificial intelligence answering phones after hours. Taking the revenue cycle management from I need three people down to maybe one person can handle it, or you can centralize it in an incredibly easy way. These are the pieces that are sexy for the doctor, the stuff that they hate. Right. We were promised back in the day that we could go to dental school, and if we were the best dentist in the world and we did the best dovetail on a filling,
Mhm.
that people would line up down and around the corner and come to our practice. That was a lie. All right. It's actually the person who
Mhm.
markets the best, spends the most on marketing, and has really cool, flashy new technology and can sell, to anybody on earth. Those are the people that really do well. So we need to help I always say, putting a Superman logo on everybody's chest, right? If I can put a Superman for business on all these practitioners' chests and help them out, help them communicate with the payers, make that easier. All these things change. Then I can get back to great clinical dentistry. I can get back to concentrating on the health of the patient. Nobody likes to stay an extra hour after work just to deal with claims issues and other things like that. Nobody wants that, right? But so if we can fix that and they can get home to their family and go maybe coach a T-ball team, that's awesome. So look for those areas where you can make doctors and patients' lives better. You're going to get a huge win.
Carrie, anything to add? And then I have one final question.
Yeah, I think, we've been talking a little bit about the fact that I think we have the audience of patients in the dental chair, but we've seen in our data that there's a good 1/3 of the population that also doesn't go to see the dentist. And so that's troubling for us in the sense of, that is a population where who knows if they're even seeing their physician. But that there's a definite void there. And one of the things that our data is telling us is that, when you are seeing the dentist on a regular basis, that investment of that time and the cost there, that's going to pay dividends down the road in terms of their dental health. But that's where we're also seeing that savings on the medical side. So very critical that, anything that we try and do to promote this innovation and integration, we need to really also look at things that are really going to help get that patient engaged, whether it's on the medical or dental side. Because once they get into the system, we're going to hopefully get them moving along. But we really need to make sure we're, again, focused on that end patient, the end user, and how they're going to benefit and have, a better um, health at the end of the day.
Awesome. Awesome. Okay, we have a few minutes left. I'm going to put you guys on the spot a little bit and open it up, whoever wants to answer first, and not to overthink it too much. But what is one thing other than Smile Health, which I know you guys are all very excited about this year, that you're most excited about in oral or more integrated healthcare for this year? It's hard to believe we're already in April. Feels like the year just ended. But would love your guys' perspective on, what it is you're most looking forward to this year and is exciting you and in your respective organizations.
Ryan touched on it. Oh, go
Go
ahead.
ahead. No, Lee, you got it. Hit it.
Ryan touched on it earlier, and we're seeing a huge investment going into generative AI. It's helping to uplift the ability for both medical and, I would say, dental practitioners to practice with it. I've said this about doctors, that they won't be replaced by AI, but doctors who use AI will replace those who don't. And I think the same is true for dental practices and other specialties. So I'm excited about the fact that there will be availability of more knowledge at the fingertips of those who are working to improve our health, and to allow them to practice at an even higher level than they practice today.
Yeah, it's interesting, Lee. Mark Benioff said the other day that if you're not disrupting yourself within the next year, you will be disrupted. Flat out, right? That's pretty intense if you think about it. So, like, and by the way, disruption usually doesn't mean like that you have a comfortable next 5 years. So it's highly recommended that you figure out how to do that. And Lee, you're 100% right. I mean, I use it every day. I use artificial intelligence every single day. I probably use it during this call somehow. And this is one of those things where, so if you're like, oh, I'm a little bit curious about this, dive in, dive in. I say that there's 3 seats on the AI train right now, and you're lucky enough right now you get to pick, right? There's driving the train, which is the most fun. There's riding the train, and then the last one's getting hit by the train. So just make sure you choose wisely. The other piece that I'm really excited about is there's a revenue cycle management renaissance happening right now. A lot of it because of artificial intelligence, but honestly, it's because we're now working hand in hand with payers. That, like I said earlier, they're like, hey, I want to solve some of my problems too. And I think we're also realizing that it's not all, it's interesting. Doctors have a real I wouldn't say it's the most amazing relationship with payers out there. We think that we can fix that. We really do. Because when you look at that, they're like, oh, well, I want to get paid more. I want to get paid more. I finally heard a payer the other day go, done. I'll make you a plan right now that reimburses you 100%. Now all you have to do is go sell it to all the employers. Right? And it was mind blowing for me because I was like, oh my God, I've been mad at the wrong people my entire life. Like I should have been mad at the employers because if they raise the price of their plans by 30 cents, they'll find somebody else. So, but it doesn't mean that the process still has to suck. And right now, we all know that it's not amazing. But now, what's nice is that, for example, Cigna is opening APIs for eligibilities. So now we can directly integrate with them. And not only do we make it so you don't have to wait on hold for 20 to 30 minutes,
Hmm.
right? Thumbs up. Now I don't have to pay
Right.
a front desk staff member for that. But guess who else doesn't have to pay somebody to answer the phone and be on hold, right? Dr. Sun doesn't have to pay for that either. So everybody's got this win-win happening now, and it's really cool because now we're able to connect everything. And because we get good eligibility information, now I can price it accurately for my patient. And then when I submit that claim instantly, right, they're able to reimburse it, and then I'm able to reconcile that on my side instantly with no effort from the front desk team. That all exists today. Now it's hooking all the wires up, right? That's what we're doing right now. But a lot of the big payers are hopping on board with this. Actually, almost every big payer is. So it's a matter of time. And within the next year to 2 years, you're going to not think the exact same about that relationship with a payer, which is really exciting.
Yeah. Yeah. I would add that, we're all about looking at using technology, AI, to do our work better, more efficiently. So those are key things, and we definitely wanted to see that it's being used well, and in terms of helping dentists diagnose better. And I think one of the other areas that we're watching closely is some of the diagnostics that are coming out in oral health, that kind of touch again more on the integrated piece, because we're talking about some medical conditions, et cetera. I think most people would rather have, to spit in a cup versus getting their blood drawn. So a lot of things happening on that side that we're watching closely. And I think that's going to be interesting to see the dynamic coming out, especially in the sense that a lot of things reside on medical versus dental. So, but that's one of the things that's a very interesting dynamic that's happening.
Thank you, Carrie, and
Mhm.
great perspectives. I know we have multiple startups in the crowd that have solutions addressing some of these topics that we've talked about today. So very much excited. We're kicking off our accelerator program. I will turn it over back to Gina to talk a bit more about that. But before I do, want to thank each of you for your time, your support, and all of the great work you're doing to advance this important cause.
All right. I am going to go ahead and share just a little bit more about the Smile Health 2025 program. One of the things that I want to share with you is that the reasons and the things that we heard about today was exactly why the Smile Health program was why the Smile Health program was developed. It was really to address questions kind of across these different areas, connecting oral health and overall health. So you can actually see on my screen right now, carequestinnovation.com/smile. We'll go ahead and drop that into the chat of the Zoom, but this is the page that we have here about the program. This year's program, as I said, builds on 3 years of success with really increased investment in more industry partners being present and involved to help with it. The 2025 program will participate in a really unique kind of semi-virtual 4-month accelerator that's going to provide a number of benefits. So the first thing that I'll share is that we are providing non-dilutive cash stipend. So $15,000 stipend, that's up from $10,000 last year without giving up any equity. Really kind of the crown jewel of this program is expert-led validation studies. So this is during the footprint of the program, being paired with an industry partner to help you really identify and work towards a key thesis around your solution. Really important to call out this year is that we have CareQuest Startup Data Hub that will have some self-service capabilities and some access to curated data. So really doubling down in that area. Additional things like mentorship, so really curated industry experts that we will bring to the companies that participate in the program, curriculum, and then Matter 6-month membership at the close of the program. I'd also be remiss to not talk a little bit about Accelerate, which is a program that CareQuest Innovation Partners has put forward for alumni companies. So after you finish the Smile Health program, you become eligible for Accelerate, which is an exclusive funding opportunity to really help scale mission to align innovation. It builds on the momentum of the work that you did during the footprint of the accelerator, and sees you paired with an industry partner to really push forward an element of your program. It provides continuity. It helps startups and partners continue collaborations beyond the Smile Health program, and really drive meaningful change. To date, we've funded 5 studies, and they've included focus on things like critical business priorities, accelerated teledentistry integration, detection for underserved populations, accelerating the path to market for a diagnostic, and really tapping into new data sources. So those are just some examples of what awaits you even after participating in this very rich program. Moving on, I want to talk a little bit about some of the tracks that we have. So we have 3 tracks for the program, which is our first track, which has been kind of the constant year over year, which is looking for solutions that are advancing accessible, equitable, and integrated health. So that is a cornerstone of the program. But then also looking at how we can engage people in their oral health, really activating individuals and communities to enhance those health outcomes and promote self-care, reducing disparities. And then significantly here in kind of the last of our 3 tracks, connecting chronic care with oral health. Today's topic, of which we heard lots of examples about how we can help people at risk of chronic conditions better manage their overall health through their oral health, and definitely the interconnectivity of those things. Throughout the pages, you'll see this start application. You'll see it really all over the place, and certainly in this very first bucket at the top. You'll have lots of opportunities as you visit the page to apply, which may make you wonder who should apply. And really, we're calling for startups that have a solution to improve oral health. We are open to global solutions. So if you're in Estonia or if you're anywhere else in the world and you have something that you think is relevant, this could be for you. We're also looking for folks that are in other disciplines. So perhaps you were already working in the health space or the more traditional medical space, but not the oral health space. Or perhaps you're working in technology and you have an innovation that's been working in another kind of vertical that you think is relevant for the oral health space. Please think about applying for the program. We are looking for solutions that have a validated hypothesis or preliminary proof of concept, so encourage you to really determine if you're a fit. We want really to make sure that you can learn more about our program, not just through today's program, but throughout the application window. We actually will have another event next Monday that we'd encourage you to join us for. Applications will close on May 4th. We will be selecting solutions. We'll be selecting solutions throughout June, where our core cohort announcement will happen. The program itself will run from late June to kind of the middle of October, with a couple really key events happening. So October 7th and 8th in Chicago, we'll have the Innovation Exchange, which is an alumni program, again, really working with companies that we've had in the last several years of cohorts. And then Reveal Day, which is a closed door event to really dive into the work that was undertaken during the footprint of the program. And then October 19th through 22nd, Smile will again be at the health conference in Las Vegas, and Smile Connect activities will happen there. That's our opportunity to support companies to meet with potential investors, potential customers, and other kind of key networking opportunities. Again, one of the cornerstones of this program is just the work with not only the investment community, but the industry writ large. We're so proud of the network of partners that we have with the program. Folks like you saw on today's session. So Henry Schein One, Seven Wire Ventures, and Cigna, among many others. Please take a look and check out this rich group of partners that are working with the program. As always, if you have any questions, you're free to connect with us. You can use this button to ask questions that you may have. smilehealth@carequestinnovation.com. Again, we really encourage you to apply and are so happy that you joined us today. With that, I'm going to just take a quick look to see if we have any questions from the audience that we can address, and we'll go from there. I see only one question here around the Smile Health, which is what kind of companies or ideas are you looking for? Again, we really are focused on solutions that hit one of these 3 track areas. It can be, an early stage company, but again, we're looking for a little bit of proof of concept and some traction in the marketplace, whether that's through clinical validation or whether that's through some existing collaborations that you might have. We'd love to hear from you. And will there be a post that I can share with my community? Yes, please visit us on both LinkedIn, X, and we're also on Instagram. You can check out for various posts. Today's event will also be posted to YouTube in a day or two here. You'll all receive an email with that link. With that, we've exhausted our questions from the audience. Again, I'd like to thank our amazing panel of participants today and certainly CareQuest Innovation Partners, and thank you for joining.